Great, so we now have first of a number of brilliant speakers that we're going to hear from during the course of today. Gerry McLaughlin is the NHS Health Scotland Chief Executive. He's worried now that I've said that he's brilliant. And as you know, Health Scotland's commitment to supporting Scottish Government's efforts to tackle inequality in health. So I hand over to Gerry as the opening speech of our conference. Thank you, Gerry, and enjoy your day, everybody.
Good morning, everyone, and there are plenty of you. The turnout for this conference is just absolutely fantastic, and it's inspiring to see so many people looking to make such a difference in the lives of children and families in Scotland. Let me start by thanking Dr. Calderwood. We're delighted that you've been able to join us today and that you've agreed to act as our conference chair. And let me also, on behalf of NHS Health Scotland and indeed the Maternal and Early Years Network, congratulate you on your appointment and offer not only our very best wishes, but also our support to you in your role as Scotland's Chief Medical Officer. NHS Health Scotland is a national health board working with partners in the public, third and private sectors to reduce inequalities and improve health in Scotland. It's our pleasure and our privilege to facilitate the network and to recognise its role in enabling practitioners to have access to evidence-based information and knowledge on addressing the health inequalities experienced by Scotland's most vulnerable children and families. Now, over the last 20 years or so, we've seen a huge investment in actions to improve health in Scotland, indeed in the UK as a whole. And that investment has paid off with a very welcome improvement in average population health, measured across life expectancy, healthy life expectancy, and many other indicators. But at the same time, we've seen no real change in the gap between those who experience the best and the poorest health outcomes. My colleague, Dr. Gerry McCartney, will present evidence on the nature of inequalities in Scotland later on this morning, so I won't look any more in detail at the moment. But in considering where the evidence takes us around the drivers for health, the determinants of health, I think it's helpful for us to think about three distinct sets of drivers, and clearly all of these are related. Firstly, that at a fundamental level, the global economic system in which we operate distributes income, wealth, and power in a very unequal way. Secondly, that the environment in which children grow up has a direct influence on their life chances. So their family income, their family experience, their education, leisure opportunities, housing, community, employment opportunities, the social protections such as welfare benefits, and of course, their experience of healthcare, all of these are influenced by macroeconomic factors. And as we've seen, many of the services on which children and families rely on for support being under great pressure since the start of the recession and during this period of the dreaded A-word austerity. The third driver is the extent to which we can reduce or mitigate inequalities by the planning and delivery of services in a different way, based on what the evidence tells us on a universal model of delivery, but with services being delivered proportionate to need. Much of the work we've done to improve health has been focused on trying to influence individuals in their health behaviours and lifestyle. And as I already said, while successful in improving average population health, this will never in and of itself reduce health inequalities. And considering this theory of causation of fundamental environmental and individual drivers, we need to turn our attention to the actions which have the power to reverse or undo inequalities, those which will act to prevent inequalities, and those which will mitigate the impact of inequalities, trying to achieve a blend of actions across all three dimensions, although perhaps more realistically for us today, the latter two of prevention and mitigation. The Scottish Government's vision is that Scotland will be the best place in the world for a child to grow up, a place where children can access all of the opportunities and support that they need, when they need it. From conception onwards, children's early life circumstances and experience shape their physical, social, mental, emotional and cognitive development and provide a future for their future attainment and health. Inequality is a barrier to the right of every child to good health. Much of our current policy for children and young people in Scotland aims to reduce the challenges by building resilience in children and families. The focus is on bonding and attachment soon after birth, on rights for access to good quality childcare, educational attainment, and integrated health and social services in order to give children the best start in life. Research relating to the prevention of health inequalities goes further than this and focuses on the adverse life circumstances and environments impacting on children and young people. And this provides a platform for the Scottish Government's policy on child poverty, strategy I should say. Poverty is a key factor in destroying children's opportunities for a good start in life and good health as they grow up. It brings material disadvantage, family stress, unstable homes, physical impacts, and mental health impacts, amongst many other factors. The 2014 review of child poverty in Scotland stated 3 outcomes to protect children from poverty: maximising household resources through income maximisation and good quality employment, improving children's well-being and life chances by focusing on the underlying determinants of poverty and improving children's life circumstances, and improving physical, social and economic environments in local areas where poverty is most prevalent. And it's with these thoughts in mind that I want to suggest that the theme of today's conference, namely the Children and Young People Scotland Act 2014, has a key role to play and can create real opportunities for all of us to make a difference. Today you'll hear presentations which will highlight some of those opportunities and consider these as enablers to implement practice which will reduce inequalities. Some of the messages you hear today will include using the progressive universal elements of the Act to address inequalities, more on the wider determinants of health for children and families, celebrating and sharing what's worked, recognising the contribution of the third sector, and I know there's a very good representation from the third sector today, early learning and childcare practice and guidance, school meals, marketing corporate parenting guidance to conference delegates, promoting enhanced partnerships and collaborative working, and raising awareness of the forthcoming final guidance on the GIRFECT aspects of the Act. An aim of the conference today is to help delegates formulate their own call to action on how you can help bring about change to enhance the well-being of children and families in Scotland and to deliver the Act in practice. In particular, I want to ask how we can together use the Act to get it right for every child, and let me emphasise, every child. And the Act challenges us to go beyond where we've often been in thinking about children and their families from our far too often compartmentalised service view of the world. Here's the rub. Why, despite our rhetoric, our best intentions, the inequalities persist, indeed widen? We should feel uncomfortable and challenged that what we have done up until now has really not made a difference, certainly not a big enough difference. Many of you will know that Albert Einstein said, "Insanity is doing the same thing over and over again and expecting different results." So my challenge to you today, when you listen to the contributions today, when you participate in the parallel sessions, think about what you'll do differently. What can and will you do differently? The Act offers all of us a fantastic platform to think differently and to act differently. Let's grasp that opportunity. Let's ensure we don't continue to fail so many Scottish children and their families. Thank you.
Need to stand up. We've got to start as we mean to go on.